All for one and one for all, promoting effective team-based care with civility, resilience, and psychological safety by Kieran, Megan, Emily, Piper, and Zoe for BCNC 2055. Meet our team. There are three separate parts to this video. We will begin by defining resilience and civility and explaining their role in the healthcare system and encouraging safe client care. Next will be a brief skit that showcases a team suffering from low morale, incivility, and lack of psychological safety. Finally, we will discuss potential barriers to psychological safety and effective communication, as well as discuss strategies to promote psychological safety, civility, personal resilience, and team resilience. And we will be using specific examples from our skit to highlight some of these main points.
Okay, so what is resilience? Resilience is the process of adapting while one faced with an adverse experience, such as in the workplace, and then having the ability to bounce back from the adverse experience.
As nurses, us as individuals, as well as our entire care team, will face unexpected and emotionally challenging situations often throughout our day-to-day shifts. But it is crucial that those challenges do not impact our ability to communicate effectively and work efficiently. Resilience allows us to continue to communicate efficiently and work effectively, even in the face of these challenging events. So if the team or the individual is not able to bounce back quickly after a challenging time, the next patient that needs care may suffer the consequences. So for example, if there was a patient that needed timely life-saving care, but the healthcare team is too flustered and disorganized due to a lack of team resilience, and they're not able to complete the necessary interventions in time, that patient will suffer. So this example kind of highlights exactly how resilience as a nurse and in the nursing team can minimize errors and increase positive patient outcomes.
So civility is an authentic respect for others that requires time, presence, willingness to engage in genuine discourse, and intention to seek common ground. Impact of civility on safety care is significant. It creates a positive work environment that promotes communication, respect, trust, collaboration among healthcare teams. Impact of incivility on safe client care includes medication errors, falls, and infections due to that staff may develop health problems such as depression, low self-esteem, and their levels of job satisfaction decrease significantly. Patients in hospital reported higher satisfaction with their care at the hospital when they saw physicians and nurses engaging in a collaborative relationship.
I'm Megan. I will be playing the patient.
I'm Zoe, and I'll be playing unit clerk.
I'm Piper, and I'm going to be the new graduate nurse. My name is Emily, and I will be playing the nurse on the unit.
And I'm Karen. I will be playing the doctor in this skit.
Good morning, Zoe.
I'm not sure about that, Piper. You know, we have 3 LPNs calling sick today, like always, right? So you got quite a workload today. You've got Mr. Smith in room 303, Mr. Johnson in 207, and all 3 patients in room, let me just check, 304.
Man, I've never had that many patients before. I don't know if I'm ready for all that.
Well, this is the way it is. Like, we always have to split patients this way. You're just going to deal with it today.
Oh, it says in the care plan that Mr. Smith is independent and can get himself to the bathroom without any help. But in his chart, it says that he's been using the bathroom with a 1-person assist. I wonder if there's been an update I don't know about. I should ask Emily because she's the RN that had him yesterday. Just ignore the Stacy. Emily,
What?
do you have time to talk about Mr. Smith in room 303? He was your patient yesterday.
Okay, yeah, what?
He was something about his assist and getting himself to the bathroom.
Yeah, honestly, you can just, sometimes he's good, sometimes he's not, okay? Like, I've got 3 patients that are being discharged today. Just read the chart, okay? I really can't baby you right now, Piper.
Hey, Piper, can you give a couple of milligrams of Ativan to your patient 304? Thank you.
Wait, I need a written order, and what's a couple of Ativan? I can't chart a couple.
Okay, there's only one dude in the room. and a couple means 2 milligrams. Didn't they teach you this in nursing school? The hospital is a total different ball game, okay? Bye.
Zoe, I'm just so overwhelmed. The physician just gave me verbal orders and I asked for a written order and he said no, and I'm still learning all the medications and I don't understand why.
Oh, Piper, you shouldn't have bothered arguing with doctor like that. They're insufferable. Like, you don't want to make an enemy of anyone here because that will make your life much harder, right? Plus the doctor prescribed the pain medication like candies here, and it helps reduce the amount of patient complaints.
All right. This isn't exactly what I pictured nursing like.
Well, clinical placement is not the same as working as an actual job, and at an actual job you have to suck it up sometimes.
Hi, Megan.
Hi. I can hear you through that curtain over at that nursing station. I just feel like it's pretty unprofessional. Saying you're giving pain meds away like candy. How can you guys complain over there while I'm stuck in this bed sick? I don't like it.
Okay, so our next slide is 4 barriers to psychological safety, which is a really important aspect for individuals as well as for the team. Psychological safety, it's the perception, the belief that you're not going to be ridiculed or embarrassed for expressing concerns, having questions, or perhaps just not knowing a particular task. It is a team effort and it requires collaboration because, of course, a team is made up of lots of individuals, and how the individual feels is going to ultimately impact how the team operates. Without psychological safety, healthcare professionals are less likely to voice concern, and this can impact client care because there could be serious procedural errors that occur, but if you don't feel safe to bring it up, this will jeopardize the patient's safety. Some barriers to psychological safety include, but this is not a limited list, gossip, a culture of talking behind each other's backs will contribute to a lack of psychological safety, lack of administrative support. For example, you bring up a concern and it's not dealt with or it's not followed through. Organizational barriers, lack of time, lack of staff, which is very salient in the current healthcare sector right now, as well as hierarchies and power dynamics. A team dynamic will involve a lot of different types of professionals and different types of sectors. And so it's important that we as a team know how to work together and understand that there is professional knowledge that works together really to promote client safety. So for potential strategies to improve psychological safety includes, but again, is not limited to, organizational culture, framing errors as mistakes or learning opportunities, as well as acknowledging that not everybody is perfect. We'll really be able to foster a culture of understanding and support, and just realizing that everybody is on the same page when it comes to learning and their ultimate goal of supporting patient healing. The second could be clear leadership and expectations, making sure that the unit nurse or the unit clerk or the charge nurse, for example, they're really modeling behavior that supports psychological safety, civility and respect on all aspects, open communication and patience among all members of the team, and engagement. So team building activities or perhaps getting to know your peers outside of work really will facilitate a person-to-person connection rather than just a profession-to-profession communication, which will ultimately impact psychological safety.
So there are also 4 strategies to promote civility. First of all, when we can seek success, right? So we can commit to client outcome and the profession first. And the second, we can reach out to nurturing and supportive nurses. And then new grad can also speak out, speak with confidence when confronted with incivility. And last but not least, the new grad also always has the right to report. So we, according to Canadian Nurses Association, they encourage a secure and helpful atmosphere for timely reporting and follow-up of any cases of violence and harassment.
Okay, so what is effective communication? It is the process of exchanging ideas, thoughts, and opinions, knowledge, and data so the message is received and understood with clarity and purpose. When we communicate effectively, both the sender and receiver feel satisfied. And now, what are the 4 barriers to effective communication? One being increased workload due to short staffing. Not having enough staff members available to provide care causes healthcare providers to be more prioritized tasks, which can lead to rushed communication and a lack of attention to patient concerns. Another barrier is power differential. Many new grads fear speaking up to doctors or senior nurses due to lack of confidence and experience, which can result in important information not being communicating, leading to medical errors that could have been avoided. Another one being unprofessional behavior. In this video, I was the physician and made many condescending comments to the new nurse. Unprofessional behavior decreases morale at work, leading to decreased motivation and engagement at work. And in the future, this might result in less communication between the provider and a nurse, which can also lead to medical errors as well. And another barrier to effective communication is not being organized when discussing important information. For example, if your client is declining and you call the doctor and list various details about a patient without any organization or logic, the provider may lose attention and dismiss the nurse's concerns. Therefore, it is essential for nurses to learn how to communicate effectively and efficiently with healthcare providers. And one way that we as future nurses could do that is using the SBAR communication.
So for promoting person resilience is important as well, because even if there are challenges in the workplace, having the ability to bounce back for yourself is a valuable asset. So resilience is the capacity to withstand and recover from challenges, pressure, or stressors. So one of the first strategies is getting enough sleep. That can really help your physical health, and which would impact your mental health. Pacheco says different processes that occur during sleep help to promote healthy brain activity and maintain good overall health, which is really important in maintaining fitness to practice. Another strategy along that vein is maintaining your mental health. When mental and emotional states are at peak levels, the challenges of life can be easier to overcome. So some of the ways that you can promote the mental wellness is by meditating, going on walks, specifically being in nature. And finally is to have and connect with your support system. These can be family or friends, or you can go seek professional support in the form of counseling or other services like that.
Okay, so 3 strategies that have been proven to be effective for promoting team resilience. The top 3, 1, allowing team members to learn from their errors. So Emily touched on this a couple slides up when we were talking about psychological safety, but looking at the error as something you want to learn from and kind of make new habits so that error doesn't happen again, instead of just punishment for the error, because it isn't going to lead to learning and changing future behavior. 2 is promoting the appreciation of each individual team member based on their specific competencies and training. And the 3rd one is encouraging collaboration and solidarity between team members. So I think the best way to implement the first strategy into the hospital was, like Emily said, to facilitate an environment where honesty and transparency is rewarded by those running the hospital, and errors are looked at as opportunities to educate ourselves. Promoting the appreciation and recognition of team members can be accomplished as making clear boundaries for the specific healthcare professionals, not just for their roles, but for the amount of impact or input people can give to people in parallel healthcare roles. And the last one is encouraging collaboration. So accepting everyone's ideas as valid and worth hearing. In the skit we did, we definitely saw the last 2 not being met in that environment. The team members did not trust each other. They didn't have confidence in the scope of practice of their individual team members at all. There was no trust, no confidence, and no collaboration, no solidarity between them, a lot of gossiping and negative talk about each other.
These are our references.